Welcome back to AFD TV. I'm Jim Guarino. We're here with Dr. Sam. Dr. Sam, tell us a little bit about what you see as the future of healthcare.
That's a really good question. The future of healthcare, as we all see every day, is sadly our country's broke and our people were broke. One of the challenges with our existing health insurance system is it was designed to be a prepaid health plan, kind of like an all-you-can-eat buffet. Even if your insurance or your food plan covers all you can eat, are we better off eating as much as we can? The answer is no. And also, if we eat as much as we can, again, who's going to pay for it? I mean, what I personally believe for the future of healthcare is conservation. And conservation is our own individual decision. Even when it comes to whether it's healthcare or it comes to food, we eat what we need to eat, but we don't need to eat more than we need to eat. Let that food or that resource go to somebody who really needs it. 90% of what we see in primary care is preventable. I mean, there are definitely going to be things out there that are not preventable, such as cancers or traumas or pediatric disorders. However, 80–90% of it is preventable. Even if we succeed in preventing 20% of that, that itself is billions and billions of dollars of savings for our healthcare system, but that's actually not even the issue. The most important part is who wants to be in a doctor's office or be in a hospital when you can be out there living life and enjoying it.
Well, let me ask you, how does the Jubilee transformation come into preventing illnesses? In other words, what are some of the things that people can do to help themselves learn how to better take care of themselves? What do they need to do?
That's a great question. I mean, I think one of the best things I enjoy about the Jubilee Transformation Program is the support group. So we don't feel alone. I mean, my wife and I are in this group, and we're with a lot of other couples who are double income, working all the time with small kids, running around, and asking each other different tricks of the trade on how to achieve that balance. Because in order to make a transformation, including in our Jubilee Transformation Program, we need to dedicate an hour a day to ourselves. The beauty of it is that it could be anything. It could be walking, it could be bicycling, it could be something we enjoy. But dedicating an hour a day in a lifestyle that's already overly hectic is not easy.
Now, in terms of the future of healthcare and tying this back to that, the Jubilee transformation, it seems to me, would be one of the best things that somebody could do to really help take care of themselves, so they can lower their overall weight and their fat and gain some more muscle, and getting the necessary exercise and learning how to eat more moderately. Those things all end up adding up to better health.
Oh, definitely. And then that's just, one of many ways. I mean, one of the biggest things that how we assess health is if people aren't really taking care of themselves, there are quite often other issues out there. And when we see somebody taking care of themselves, and then generally life in general tends to get more balanced. I mean, I've looked long and hard to find groups that help people come together for life balance, and they really are rare. I mean, what I see from a day-to-day practicing physician is life balance is really the key.
Well, thank you for your insights. We appreciate it, and thanks for having me on AFD TV.
Great. Thank you, Jim.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Sam Yadrala and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.